Good afternoon. I am Dr. Susmita Roy of Department of Food and Nutrition, BRSN College. Today I am going to present my topic energy balance and obesity, that is a part of undergraduate curriculum Sem-IV Clinical Nutrition and Dietetics. Now what is energy balance and energy obesity? Energy balance actually is a condition in which the input of energy is practically equals to energy expenditure. It may be of three different types, that is zero energy balance, positive energy balance and negative energy balance. In case of zero energy balance, the input of energy is almost equal with the energy expenditure through different routes. In case of positive energy balance, the input of energy through different foods mainly exceeds to energy expenditure. That is very common in puberty, in pregnancy and in different physiological condition. In case of negative energy balance, the input of energy is lower. The expenditure of energy exceeds the input of energy. The expenditure of energy occurs through different physiological functions, that is voluntary functions, different involuntary functions, that is BMR, SDA, etc. So, these are the different patterns of energy expenditure. Now, coming to the expenditure of energy and its different components. There are mainly two components of energy expenditure. First, it is voluntary expenditure, that is energy spent on daily physical activity due to muscle contraction and different functions. And the second one is energy spent in response to a variety of thermogenic stimuli, which is known as the thermogenesis process. That includes consumption of food, SDA, physiological functions, regulation, different regulatory functions, BMR, etc. So, the difference in energy balance causes different spectrum of malnutrition that may include undernutrition as well as overnutrition. Today we are discussing about overweight and obesity as a part of overnutrition. It has been observed that obesity occurs or overweight occurs when excess energy is stored in the fat cells. Actually, by definition, obesity is accumulation of body fat above a certain level, above certain percentage. So, fat cells enlarge and increase in number and accumulating in the abdominal region, in muscle, around different organs such as liver, pancreas, kidney and heart. This proliferation of fat cells produces numerous metabolic, hormonal and inflammatory chemicals that adversely affect body's arteries, tissues and organ function and hampers with different regulatory functions. The inflammatory and metabolic changes to body processes result in high cholesterol, hyperlipidemia, dyslipidemia, hypertension and elevated blood pressure, insulin resistance, type 2 diabetes and impaired glucose tolerance. So, altogether these complications may arise the non-communicable disease. So, obesity taking into consideration is a global problem nowadays. Obesity is a preventable cause of death, it is a leading preventable cause of death worldwide and its increasing prevalence is occurred in both adults and children. Why it is known as preventable cause of death? Because obesity can be prevented if it is detected early stage and it is cause of death because the complications of obesity or the comorbidities associated with obesity are numberless. That may contribute to mortality, even if not mortality, it is low life expectancy. So, it is known as preventable cause of death. It is one of the most serious public health problem nowadays in the 20th century, 21st century. It is stigmatized in much in modern world. But although it is thought that obesity is a problem in the modern world, but it has been found that obesity is very common in both developed and developing countries nowadays. Overweight and obesity rates are very high and increasing rapidly across the world in both developed and developing economies, countries, and its burden is growing rapidly in every region of the world. The burden of overweight and obesity has nearly tripled since 1975 and now accounts about at least 4 million of deaths per every year globally. And rural obesity and overweight is growing rapidly even in developing countries. Worldwide, as of 2016, an estimated 44% of adults, which is almost more than 2 billions, are overweight or obese, and over 75% of them are living in low or middle income countries, dispelling the myth that overweight or obesity is a problem of high income group. Actually, the low income group and low income and middle income countries are confronted with a double burden of malnutrition or a coexistence of both overweight, obesity and undernutrition. This is the most crucial thing in case of low and moderate income countries. Over the next several decades, these trends are likely to increase significantly unless urgent action is taken to curtail this progression. Furthermore, as the countries grow economically, as per capita income increases, the burden is shifting even more towards the poor, with potentially devastating impacts on the health of the poor, on the need of financial protection, especially for the poor, and overall economic development. Obesity is very common and number of comorbidities are there. Some of them may lead to death and low life expectancy. It has been observed that obesity and comorbidity associated death is quite high nowadays. Worldwide, an estimated 44% of adults are suffering from obesity and 20% of the total children with an age group of 5 to 5 years, over 5 years or 5 to 19 years, those are called children and adolescents, are suffering from either obesity or overweight. And the data is tripled almost from 1975 to nowadays and accounts for approximately 4 million of deaths throughout a year all over the world. And 2/3 of this death is due to different cardiovascular diseases. It also accounts for 120 million of loss of disability adjusted life years. So, once considered as a public health problem only in high economic prosperous countries, overweight and obesity is now prevalent in low and middle income countries. As a consequence, low and middle income countries are facing a double burden of malnutrition where the coexistence of undernutrition and overnutrition are present. That is a characteristic definition of coexistence of the two type of disease in the both wide spectrum. This picture depicts the worldwide scenario of the obesity and overweight. This color representing the percentage of obesity throughout the world. It has been observed that United States, some part of North America, United Arab countries and some parts of European countries, commonly considered as prosperous countries, are suffering from obesity at a rate of 30 to 40%. Total population, 30 to 40% of the total population are suffering from obesity. Whereas it has been observed that other parts in the in parts of South America and North America, a part of South Africa, Australia, etc., and part of European countries are suffering 10 to 30% of the total population are suffering. Is definitely a disease, a burden of prosperous countries. This is a figure that indicates the total population suffering from obesity and overweight. This data indicates the national flag of different countries and the percentage suffering from obesity in that particular countries. Again, this is a diagram indicating the global overweight and obesity rate. Under 5 children, 5 to 19 age of children and adolescent, and adult above 20 years. The data is taken from the fact sheets of UNICEF, WHO and World Bank 2016. This figure indicates that children under 5, a total population of 5% are suffering from obesity, where in case of adolescent and children and adolescent from 5 to 19, it has been observed that total 20% of the total population are suffering from overweight and obesity. Moreover, it has been observed that among the girls, it is 18 to 90% of the total population is suffering from overweight or obesity, whereas in case of boys, adolescent boys, it has been observed that they are more prone to obesity. Among adults, 44% of the total population are suffering from obesity, but when it is compared between men and women, it has been observed that women are more prone to overweight and obesity, and definitely endocrine play a huge role in this case. Again, this figure indicates the trend in the number of adults, children and adolescents with obesity and with moderate and severe underweight by different region. These are the countries, and this graph represents the obesity for men, this is for women, this is for adolescent girls, and this is for adolescent boys and children. This study was conducted from 1980 to 2010 onwards. It is the long duration study conducted in a gap of 10 years, which indicates the sharp increase in the trends of obesity in different countries. Now, obesity is a burning problem not in our country only, but throughout the world. So, we should know the different causes of obesity. If we consider the obesity and its cause, the first cause is probably the inheritance. Genetic factor plays a very crucial role in occurrence of obesity. Different studies shows that there is a strong genetic basis to the development of obesity. Obesity appears to be a polygenic disorder, and in which many genes are linked associated with predisposition of excess adiposity. At least 5 single gene mutations causing human obesity that are present in childhood have been identified in different experiments. So, the next factor may be age and gender. Obesity is a problem with positive energy balance, and obesity may occur at any age, any gender, when only the person is put in the positive energy balance. That is the most important causation. But it has been observed that females are more prone to obesity, and female reproductive endocrine play a vital role in the causation of obesity. Eating habit is another important factor that plays a very important role in obesity. Excess consumption, eating at a faster rate, nibbling between meal, snacking, all the habits increases obesity. Excess consumption and consumption at a very faster rate, taking less time for chewing, actually increases the amount of food consumption. Eating at a faster rate with less timing for chewing ultimately inhibits the satiety center present in hypothalamus, by which we can increase our consumption more and more we eat. Nibbling between 2 meals actually increases the calorie consumption. Now, what is nibbling? Nibbling is a kind of eating that actually require some snacking item like sugary items, sweets, chocolates, etc. And nibbling occurs usually between 2 principal meals, like between breakfast and lunch, or evening snack and dinner. So, nibbling is a kind of thing when we require some very few amount of food, but those are mainly with high calories. So, nibbling between meals is a cause for obesity. Different business meeting and corporate lunch includes a high calorie diet, high calorie food that may be a cause for obesity. Housewives who are fond of cooking and they do not want to throw the leftover food usually consumes more and may lead to obesity. Again, here is a factor that female endocrine play a very crucial role in case of obesity. High calorie food, fast food consumption again causing obesity. Different mental status increasing depression, and fasting, feasting and long gap between two meals may result in obesity, but mental status actually increases craving for some sugary item. We will discuss this later. Sedentary behavior and poor physical activity is a reason for causing obesity. Physical inactivity actually is a major element in the development of obesity in westernized societies and in urbanized areas. Different international studies have shown that viewing television is associated with increased incidence of new cases of obesity as well as in decreasing the success rate of intervention program against obesity. Viewing television exposes the children to different food marketing, increases the opportunity for snacking high calorie food and drinks, decreases the opportunity for physical activity, outdoor games and reinforces sedentary behavior among them. As a result, obesity occurs. Urbanization and civilization, modernization again is causing obesity. It is most common in prosperous countries like USA, UK, European countries, etc. And people both from developed and developing countries with high purchasing capacity, who can purchase more, who can have the sedentary lifestyle and who have the level saving, all the level saving devices are prone to obesity. Civilization even leads us to have lots of labor saving devices that are reducing our daily labor, our physical activity and leads us to a very inactive and sedentary life, and this is ultimately resulting in obesity. Some social and cultural factors are also there that is causing obesity again. People belonging to upper socio-income and high purchasing capacity group are more prone to be obese because of their high calorie nutrient dense diet. Even it has been observed that usually their diet is dense in animal protein and animal fat, both of which serves as a concentrated source of energy, and as a result there is positive energy balance putting the person in obesity. Moreover, they have faulty food habits, luxurious lifestyle with minimum physical activity. Physical inactivity, high calorie and luxurious lifestyle is leading them towards obesity. This picture indicates the vicious cycle of childhood obesity, how a healthy child is converted into an obese adult. Here a healthy child who is used to with the television, computer game, video game and this type of indoor games and have a very faulty food habit like consumption of candy, cakes, chocolates, etc., chips, etc. Ultimately, it refuses to do the physical activity, outdoor game because he is very sedentary in nature and becomes mildly obese child. Again this mildly obese child refuses to do the physical activity. His food habits are already faulty and results in a moderately obese child by gaining extra 10 pounds of body weight, and he want to inhibit actually different type of physical movement. This moderately obese child again by gaining extra 20 to 50 pounds of body weight. He refuses to do any exercise, he is very uncomfortable with any kind of physical activity and ultimately lead to a severely obese child. A severely obese child ultimately turned into an obese adult with asthma, diabetes, different disease, musculoskeletal disease, cardiovascular disease, coronary artery disease, etc., pulmonary disorder and even low life expectancy and mortality. So, in this way a obese child, a healthy child even, turned into a obese child and finally to an obese adult. Some emotional factors are there that can influence obesity. It is very closely related to our emotional ups and downs. Overeating and craving for sweet things and high calorie things increases during some emotional conditions like stress, depression, frustration, loneliness, boredom and feeling of social rejection, feeling of rejection from the peer group. This is very common with kids, children and adolescents. Rejection from the peer group, because an obese child cannot play and he don't want to play outside games and he is rejected by his friends and feels very lonely. And as this requires, and this in case of this stress and depression, we sometimes need high calorie sugary substances and sweets. This may lead to obesity. Endocrine status plays a very crucial role. Abnormalities in different gland functionings and metabolisms may result in obesity. This is very common in hypothyroidism, hypogonadism, in pregnancy, in puberty. In early puberty, positive energy balance is very common. In pregnancy, positive energy balance is actually required. And in pregnancy, different hormonal role actually helps to gather the body weight, to increase the body weight, that is actually required. And obesity is very common in female due to female reproductive hormone. So, obesity has grown as one of the most important epidemiological problems throughout the world in modern societies. This increased consumption of high calorie food associated with progressive reduction in the physiological activity accounts for most cases of obesity. In recent years, a very impressive progress has been made and on the characterization of hypothalamic mechanism of food intake and its regulation. According to the data obtained from different animal studies and experimental models, weight gain is paralleled by a phenomenon of hypothalamic resistance towards the anorexic and anorexigenic and thermogenic inputs delivered by the leptin and ghrelin, two hormones that play a very crucial role in occurrence of obesity or in the regulation of food intake. This resistance to the disruption is tightly regulated, coupling between energy intake and expenditure. So, there are some hypotheses related to obesity and role of feeding and satiety center in occurrence of obesity. Now, what are feeding center or hunger center and satiety center? The hypothalamus in our brain plays a very important role in regulation of food intake and maintenance of body weight at a constant level. There are two different centers present in hypothalamus. One is hunger center or feeding center, that is when stimulated increases the feeling of feeding or hunger, and one is satiety center, that is when stimulated decreases the feeling of feeding or hunger and increases the value of feeling of satiety or feeling of fulfillment. So, feeding center and hunger center. Feeding center, what is feeding center or hunger center? It is situated in the lateral part of the hypothalamus and it helps us, when it is stimulated, it helps us to feel hungry, and this center is inhibited by any stimulation from the satiety center. It has been found that neuropeptide Y, a polypeptide which is a component containing 36 amino acids, helps to stimulate the food intake or feeling of hunger. There are two other hormones, there are two other components known as orexin B. Orexin, the term is actually referred to consumption of food, orexin A and orexin B. They have some appetite stimulating action. And what about satiety center? That is another center present in hypothalamus. Definitely it is situated in the ventromedial nucleus in the hypothalamus. Satiety center helps us to feel the fulfillment or to stop hunger or to stop feeding actually. So, any stimulus, any positive signal from the satiety center inhibits the feeding. Any lesion in the ventromedial nucleus removes the inhibitory effect from the feeding center, and this results in excessive feeding and leads to characteristics of hypothalamic obesity, which is a clinical condition. So, here is the role of leptin in the accumulation of fat. This is the hypothalamus and how it acts, we will see how it acts. Leptin is found mostly in subcutaneous fat and it is stimulated in the body by different factors. The primary function of leptin is to increase satiety and utilize the energy expenditure through the action of hypothalamus. In the muscle, leptin action increases the glucose uptake and glucose metabolism in the liver. Leptin increases glucose production. In the pancreas, leptin increases the release of insulin. Insulin is a hormone which is closely associated with glucose utilization. It utilizes glucose and hunger center is activated. Now, what is the role of hypothalamus? We will see again. Hypothalamus, from hypothalamus arcuate nucleus is there where two types of neurons are present. There are two types of neuron and these neurons are secreting some performing some stimulating action, that is hunger stimulation or orexic effect, and inhibiting action or anorexic effect. Neuropeptide Y and AGRP are doing the stimulating function, and alpha MSH and CARD are doing the anorexic effect or inhibitory action. But all the neuropeptides acts on ventromedial nucleus or hypothalamic lateral hypothalamic area on hunger center and satiety center. So, how obesity causes type 2 diabetes, and polyphagia is a common symptom in type 2 diabetes and diabetes related obesity. It is very common that obesity is associated with type 2 diabetes or type 2 diabetes is associated with obesity. Why it occurs? Polyphagia is one of the reasons for it. Hyperglycemia and diabetes are two clinical conditions where low glucose utilization is there. Low glucose utilization stimulates the activity of satiety center. Actually, due to low glucose utilization, activity of satiety center is depressed. When the satiety center is inhibited, that means the hunger center is stimulated. Hunger center or feeding center is stimulated. So, stimulation of the feeding center due to loss of inhibition of feeding center increases food consumption. Diminished activity of the satiety center and excess food consumption due to no inhibitory signal to the hunger center results in more and more food consumption, that is known as polyphagia. Polyphagia is a characteristic symptom in type 2 diabetes, which is very common in type 2 diabetes, which may lead to obesity. So, all these are the physiological regulation and mechanism of obesity and hunger sensation. So, coming to the some stimulation that may influence the regulation of food intake. It is a motor activity controlled by the central nervous system. It is initiated by hunger, a complex physiological sensation, and it is influenced by hypothalamus. Different stimulus are there like chemical stimulation, nervous stimulation and thermal stimulation. Chemical stimulation is actually the presence of a chemical in our body that stimulates or inhibits hunger, feeling of hunger. When any chemical is present and that is causing the feeling of hunger is a positive signaling or positive stimulation to the hunger center, and if it is inhibiting the hunger center, then it is stimulating the satiety center. For example, insulin in blood is making people hungry by lowering the blood glucose level. Why it is lowering the blood glucose level? Because insulin is responsible for metabolism of sugar. It is utilizing sugar and thus it is lowering the blood sugar level and making the people hungry. So, it is stimulating the hunger center in a positive manner. Coming to the nervous stimulation occurs or playing a role into different ways. First, it is helping in the contraction of the stomach. Contraction of stomach is inducing us the feeling of typical hunger. Typical feeling of hunger is done by the contraction of stomach. Secondly, nervous stimulation stimulates the hunger and satiety center according to the need of the body. Next comes to thermal stimulation. What is thermal stimulation? Actually, environmental temperature influences us to have food or not to have food, or to have some choices of our food. It has been observed that as heat production is related to food directly, it has been observed that whole climate influences the consumption of high calorie food. Again, a different topic, that is pregnancy induced obesity or gestational obesity, that is very common. Pregnancy induced obesity is a specific physiological condition that is common, and this obesity is sometimes it may be a transient in particular phases, and sometimes it may continue for long. During pregnancy, almost 12 kg of average body weight is increased. But this weight gain is due to mainly three factors: due to protein, due to fat, and due to water accumulation. So, after the parturition process, that is termination of pregnancy, excess water is removed from the body as a normal physiological process. Protein is reduced from the body, that is also within normal physiological process, but there is no such process, normal physiological process, to remove the additional fat that is accumulated during pregnancy, and it is stored in the adipose tissue and cannot be lost without any physical activity. So, if there is poor physical activity, this fat accumulates and it continues for a long and results in obesity. So, after knowing the different causes and etiological factors of obesity, we should know how should we classify obesity or how should we measure obesity. Actually, extent of obesity and overweight should be measured by measuring the lean body mass and total body fat. The responsible factor for obesity is the total fat, but not the lean body mass. The definition of obesity is accumulation of fat above a certain level. So, we should measure the body fat. A study was carried out from 1950s and up to 2004, it was continued in a gap of 10 years, and it has been observed for female that the bust line increases in 50 to 55 years just from 94 centimeter to 96 centimeter. But in case of waist and hip, the increase is from 70 centimeter to 86 centimeter and 99 centimeter to 102 centimeter. This indicates that abdominal obesity, both in case of male and female, but it is very prone to female, abdominal obesity is increasing. This result reflects that. So, if we consider the pattern of obesity, this is of two types: developmental and reactive obesity. Developmental obesity is a pattern that starts at a particular phase of life and it continues very slowly and it continues for a long. But in case of reactive obesity, it is very much related to emotional stress and many hormonal factor that can be easily curative. It is very common in adolescent phase, which is characterized by endocrine rash. If we consider obesity by body weight, it is of three types: grade 1, grade 2 and grade 3. Grade 1 is the initial stage of obesity that can be cured with simple dietary modification and some regular physical activity. Grade 2 obesity requires high grade of dietary modification and physical activity, and grade 3 medication, grade 3 obesity definitely needs medical supervision and even surgery. So, how we can assess obesity? The most easily but partly inaccurate method is BMI. BMI is a method by which we can measure obesity. Body weight and body weight percent is another method. Total body fat, skin fold thickness, waist circumference and hip circumference, waist to hip ratio and different indices. So, assessment of obesity, how we can measure? Body mass index is an index that takes weight in kg and height in meter square. This is the normal range and obesity is of 3 types. This is the body fat weight percentage. In case of more than expected 25%, it is mild obesity. In case body weight is more than 50% of expected, it is moderate, 75% it is severe and 100% it is very severe. Total body fat. This is a really good method for measuring obesity and it is considered as gold standard for measurement of not only body fat but body component. But the most important thing, this is a very delicate method and require high instrumentation and technical skill. In this method, body fat is measured by density, measuring the density of the body where D of fat, that is density of fat, and then density of lean body mass is already given and it is calculated by this equation when X is the percentage of body fat. Actually that is required for measuring obesity because by definition obesity is percentage of accumulation of excess body fat, which actually we required to know during measuring obesity. But the problem is with that this method is we can measure this method by using Archimedes principle and the method is densitometry or underwater weighing. But this method is critical because it requires high amount of instrumentation and skill and underwater weighing is not very easy method. On the other hand, skin fold thickness also measures the total subcutaneous fat. In the triceps subcutaneous fat is measured and it requires Harpender calipers, Lane calipers, etc. And this is a very easy method and not at all very costly. Waist circumference and hip circumference are indicators of abdominal obesity. These are used to measure abdominal fat and one factor is there, that is conicity index. Conicity index also measures the abdominal fat. High risk, when men more than 40 inches and women more than 35 inches of waist circumference, it is considered as high risk. Another index is there, ponderal index. Ponderal index again is very similar with body mass index, is also taken into account the height in inch and cube root of weight in pound. But ponderal index, corpulence index, different indices are there. These are calculative method and they have some error. Broca's index is another index that gives us about the idea of actual body weight or the ideal body weight. Height is taken in this method, height is taken in centimeter and 100 is subtracted from the actual body weight and we should have an idea about the ideal body weight. It is very easy to calculate, more or less accurate. And the waist to hip ratio, normal waist to hip ratio is 0.7, but in case of obesity 0.85 for female and more than 1 for male, the person is considered as obese. So, coming into the complications of obesity, there are different type of complications. First, it is morbidity. Obesity is associated with number of comorbidities. Some of them are contributing to mortality and if not mortality, it is contributed to low life expectancy. This figure depicts the different complications and health risk associated with obesity. We can see there is mechanical stress, increased free fatty acid synthesis, sex hormone imbalance, etc. And all the effects or comorbidity may lead to disability or sometimes it contributes to mortality. Talking about the mechanical stress, sleep apnea is the most common thing. What happens in sleep apnea? This is a transitory situation, a transient situation when sudden stoppage of breathing occurs. Due to largely infiltrated fat in the abdomen, this person cannot breathe in, breathe out properly and due to large infiltration of fat in the abdomen, the diaphragm cannot expand properly, and suddenly it restricts the inhalation of air suddenly for a transient situation. This is known as sleep apnea. Then comes the osteoarthritis, knee jerk, joint pain, fracture, sudden accident, etc. All these are under disability, and this is mechanical stress. So, low back pain. Sleep apnea, sometimes that is known as shortness of breath again, sometimes contribute to mortality. Coming to the increased fatty acid synthesis and its consequences, this is known as metabolic syndrome. It influences insulin resistance, type 2 diabetes, hypertension, dyslipidemia, hyperlipidemia, atherosclerosis, etc. These conditions ultimately results in mortality. Sorry. Sex hormone imbalance may result in a progression of different hormone dependent tumors that ultimately results in death. So, mortality and low life expectancy are very common with obesity. High rate of mortality from different diseases like CVD, cancer of different organ results in low life expectancy. Locomotor activity and poor physical activity are observed during obesity, and lower extremity complications are very common. It has been observed that a normal individual ultimately turned into an obese individual, and the entire body weight, the legs, the extremities has to carry the extra body weight. That is putting a burden into the lower extremities. Lower extremity complications are very common for this reason, like flat feet, osteoarthritis, joint pain, etc. Hip and lumbar spines are highly affected because of the extra body weight. The abdominal muscle, which supports the viscera and leg muscles, are infiltrated with fat, and physical disability is very common with high grade obesity, that is grade 2 or grade 3 obesity. So, there are some complications with system, organ and system. Some neurological complications are there. Some cardiovascular complications that includes hypertension, dyslipidemia, hyperlipidemia, chronic inflammation, endothelial dysfunction, atherosclerosis, etc. Some endocrinal imbalance like insulin resistance, type 2 diabetes, impaired fasting glucose and glucose intolerance, type 2 diabetes, menstrual irregularities, PCOS or polycystic ovarian syndrome, etc. are common. Musculoskeletal system affected and flat feet and joint pain are common. Glomerulosclerosis is very common, which is under excretory system. Gastrointestinal problem may be there, fat infiltration in the abdomen, gallbladder stone, poor gastroesophageal reflex, non-alcoholic fatty liver injury, those are very common with grade 2 or grade 3 obesity. Different pulmonary complications are there like exercise intolerance, because people due to accumulation of excess fat, physical inactivity is there. They are not ready to exercise, and exercise intolerance is a very common thing. Sleep apnea, obstructive sleep apnea is common, asthma is common, and some psychological problems like eating disorder, that is bulimia, anorexia, binge eating disorder, poor self-esteem, body image disorder, social isolation and stigmatization, etc. are common. Coming to the respiratory problems, that is a very important thing in sleep apnea, because a number of people with grade 3 obesity are suffering from sleep apnea, and they seriously require sleep management or therapy for curing or for managing the sleep apnea, this condition. Sleep apnea, as I told you earlier, it is a sudden stoppage of breathing due to fatty infiltration in the abdomen. Accumulation of excess adipose tissue interferes the process of respiration, resulting in breathing difficulty. In sleep apnea, respiratory trouble occur during sleeping. Due to the position of sleeping, the fat is infiltrated in the abdomen, which inhibits the diaphragm to expand and allow the air to enter within the lung. Due to this inhibition of the diaphragm, air cannot enter into the lung, and due to sudden stoppage of this inspiration process, We cannot respire properly for a transient situation, that is sleep apnea. It is a very sudden and transitory situation. It is very common in children and adolescent, but it is very critical in case of adult suffering from grade 3 obesity. Some cardiovascular problems are there. They are prone to CVD. High blood pressure and hypertension is a common complication. Cerebrovascular diseases are very common. Artery, vein related problems, arterial blockage are very common, and irregular heartbeat with drop beat are very common with obesity. Different metabolic disorders are there. Obese patients are more prone to diabetes, mainly type 2 diabetes. Plasma cholesterol level is usually high in obese patient due to accumulation of excess fat that may lead to arterial blockage and occurrence and consequences of atherosclerosis. They are more prone to gallbladder stone because one of the gallbladder stone is synthesized from cholesterol, that is known as cholesterol stone, and obese patients are more prone to cholesterol stone. Gout is a common metabolic disorder in obesity. There are obstetrical risk and psychological problems common with obesity. Greater chance of obstetrical risk due to excessive weight gain, hypertension, diabetes, gestational diabetes obviously are common during pregnancy, and psychological problems already I told you, that is stress, depression, frustration, loneliness, boredom, feeling of social rejection, etc. are common. So, how to combat with this situation? We should combat with obesity, that is a preventable disease. That is very much, that can be prevented very easily if we can detect obesity and if we can manage it properly. So, to combat with this obesity, first we should know the BMI or the parameter by which we can measure it. After knowing this, if the body weight is normal, everything is normal, encourage the subject for leading a healthy life, eating a healthy food and regular physical activity. If the person is overweight or obese, then assess for the risk factor. How much is the risk factor? First, you have to assess the risk factor, then we have to suggest them for the dietary modification, for the regular physical activity, for drugs if needed, for bariatric surgery if needed, according to the need of the patient. So, this is a chart indicating the dietary modification. Actually, the dietary modification is one of the key factor that can prevent or even cure partly obesity. Weight should be lost at a rate of 1 to 2 pounds per week based on a deficit of 500 to 1000 kilocalories per day. And weight reducing or weight maintenance diet are there. There are two different diets. At the very beginning, we should use the weight reducing diet because we have to reduce the excess body weight. So, we use diet 1 and diet 2, weight reducing diet 1 and diet 2, and then after reaching the desirable level, desirable body weight, we should maintain the weight. We should maintain the weight, and for this we should use the weight maintenance diet. A weight reducing diet is approximately of 1200 kilocalorie and weight maintenance diet is of 1500 to 1800 kilocalorie. So, this is a step 1 diet. Calorie recommendation and nutrient recommendation is according to intake or as per requirement, as per ideal requirement. Total calorie approximately 500 to 1000 kilocalorie reduction from usual. Total fat should be less than 30% of the total calorie, among which saturated fatty acid should be up to 8 to 10% of the total calorie, monounsaturated fatty acid up to 15% of the total calorie, and polyunsaturated up to 10% of the total calorie. Dietary cholesterol should be always less than 300 milligram per day to reduce the hyperlipidemia, because hypercholesterolemia, hypertriglyceridemia are very common with obesity. Protein requirement is approximately 15% of the total kilocalories. Carbohydrate requirement is 55% of the total kilocalories, among which 60 to 65% of the total carbohydrate should come from complex carbohydrate, because complex carbohydrate have some beneficial effect in to combat with obesity and obesity associated different complications like diabetes, like cardiovascular disease, etc. Sodium intake is restricted if there is elevated blood pressure and hypertension. Fiber consumption should be 20 to 35 gram per day. So, to combat with this disease, the first key factor we should consider is dietary modification along with physical activity and other factors. And this perhaps the greatest challenge will be triggered to meaningful transformative changes in the food system to deliver safe, diversified, healthy diet. Finding the right balance of the food that is healthy for each and every people. Undernutrition, overnutrition share the root causes in the food system that does not deliver any nutritious diet in sufficient quantity or affordability related to non-nutritious and unhealthy diet. Though food system interventions are yet to show robust evidence of effectiveness in their impact, there is a clear need to continue to work towards the improvement of healthfulness of the food system. So, this involves working across the entire food chain from farmer to the retailer to the consumer to ensure the shift in the relative prices of healthy versus unhealthy foods. With increasing urbanization and low middle income countries, greater involvement of the social protection and governance sector may be necessary to support the transformation in the urban system. As the obesity is nowadays, it is not the disease of only urbanized and prosperous countries, but it is entering in the lifestyle of the poor and middle income countries with the poor and middle income group. And they are suffering, actually the poor and middle income group are suffering from a double burden of malnutrition, a coexistence of both undernutrition and overnutrition. So, we should combat with proper food system, proper diet, proper healthy diet and regular physical activity to overcome the condition. Thank you.